afternoon, friends. Today is Thursday, and we are back again with our presentations. Uh, here we are having the offline and online class on every Thursday for the practitioners as well as any homeopaths who wish to learn more. Today we have started now the case taking. And the purpose of step by step we are going ahead to understand. In our last lecture we had talked about the introductions to the case taking, and in this seminar, in this lecture we are going to discuss about the chief complaints that is to be narrated by the patient. So with these things I just upload my PPT so that we can have more interactions. So case taking for the chief complaint. Immediately after the introductions, we have the opportunity now that the patient is very much worried about telling his problems. So immediately after the introductions, we have to undertake the chief complaint, and this is the area most interesting area as well as most important area for the case taking. I said it is the heart of the case taking, the heart of the case taking. And when you are discussing the chief complaints, the patients are very much interested in to tell their problems first. So this aspect we have to utilize both for listening to the patient as well as utilizing and finding out the problems that is there. So case taking in the chief complaints in the clinical conditions. This is the topic today, and chief complaints are the subjective statement made by a patient describing the most significant or serious symptoms or sign of illness or dysfunction that caused him or her to seek help. Why the patient comes to you? It is not only because he is having the other problems. He comes only because he has a he has some problem, and that is his subjective problem. And he is very much concerned about it. He is very much concerned about the problems. He is very much concerned about the signs, and he is very much concerned about what is happening on the body. So only because of the concern, patient gives a physician. So doctor-patient relationship is dependent on the concern, that is the base, that unified fact part of the case complaint. This is the doctor. And this complaint is called a conscience. It is a conscience statement. We call it the presenting complaints or chief complaints. So both are a conscience statement which includes the problem, the condition, diagnosis, physician's recommendations, and reason for consultation. What is the problem? This is very important. And what are the conditions? In what state the patient is coming to you, and what you are going to diagnose it, and what recommendations you have to make, and then why the patient has consulted. This is very important because a patient used to visit our clinic only because of someone either refer or he has heard about us. So these are the consciences, these are the regions, these are the positions for intercount patient meeting to us. This complaint is a client state stated reason for seeking care at the present time. This is also sometimes called the presenting problem. This is typically the answer to your variation on the opening question. Tell me what brings you here today. Record the answers verbatim. Now, when the patient comes to you, either he starts talking to himself, or you have to ask him, now tell me what is the problem, why you are here, what is the problem with you. So these are the opening sessions, And after having the introduction, you ask the patient to tell the problem. And if the patient is not, sometimes you don't need to tell them start. They start just and because they are very much worried, they are very eager to tell you the problem. So both way you have to initiate about the presenting complaints. Then if claim complaints, the first step is uh, uh, the reason for encounter. It is called RFE, reason for the encounter. Encounter means meeting you. These complaints are the subjective statements made by a patient describing the most significant or serious symptoms or sign of illness or dysfunction that cause him or her to seek their health care. And it is used most often in a healthy history. It is a set of symptoms, disorder, request or concern expressed by the patient when seeking care. If the patient is unable to express themselves, the healthcare professional may make assumptions based on information from attending and their own initial observations. Now, how Dr. Henneman has also mentioned about the problem, how we can get the information from the patient. He says either the patient tells you the problem himself, he is able to tell the problem, or if he is not able to tell the problem, what the attendants is doing it. And third, the most important source is physician himself who makes his own observation. So Dr. Henneman in sixth file talks about the patient statement, he talks about the importance of the attendant remark and observations made by the physician. So, two aspects are there. Why the patient is coming to you? The answer is seeking the treatment. You want the treatment. You want the support. Usually, all human beings, when they are troubled, try to solve their problem themselves and is not concerned immediately unless they feel that they cannot manage them. Now, this is the human behavior that patients don't want to be with the doctor or anyone because taking support is just like begging. So no one wants to beg, and one used to beg only when they find themselves not able to manage their things. So when they feel helpless, or even after realizing the gravity of the situation, they consult their own and the next day, most confident people are the relatives, their own near and dear ones, and so first they try to solve themselves, then they seek the support of their near and dear ones, and and only after the both fails, they encounter the physician. So what we can say, a doctor is within every human being, and they try to tackle so it is the referral system. When the patient is not able to solve themselves, they say, they refer their problem to the attendant, and when the attendant is not able to solve the problem, they refer the problem to the doctor. So it is a referral system that follows in every human being for getting the treatment because we want to solve our own problem, and solving the problem is a doctorate work. So this the place where we can solve ourselves, we don't need not to meet any of one other one. And ascertaining the reason for encounter. Now, why the patient has come, we have to find it out. There are the different type of the patients. There are confident patients. Confident patients, they seek treatment only after realizing the gravity of some time, after some time when actually the problem initiates. In the beginning, the confident people of my problem will get solved. No, it is very minor problem. But when it continues, it becomes chronic and it is not going, then they become concerned and they will come to you. In these type symptoms may be well matured or changing due to the self-medication. Now, confident people usually don't go to the doctor. They try to wait for some times to get the change. So what you will find in these type of the patient symptoms are very much matured, or they may be altered because he may be taking some medications, some type of the medicines by himself. So self-prescription is there, and maturity of the symptoms due to the activity. Then there are the nervous patients, and they see immediately with the mind problem. They start immediately meet up diseases, and symptoms here are not so much developed. They may be in the and exaggerated in the triple seems important. Which that you can see, they will tell you the things in detail or rather in a large scale. For the minor problem also, they express their feeling very great way. Then there are hypochondriac patients. These are type of the patient usually keeps on visiting from clinic to clinic and changing doctor. So they are not satisfied with the treatment given and get restarted quickly. So these are the different type of the patients that you may meet telling their problem. There are also some patients who may become panic even at the slightest and the minor problem. So this is the hypochondriac patients. These type of patients have no confidence in themselves. They take up the situations with great anxiety. They feel themselves always in a state of disease and become accustomed with the problem. So they find happy when the doctor tells them something great. So these are the hypochondriac patients. Here, symptoms are often mixed with the medical symptoms. They are usually suffering from the drug disease. So hypochondriac patients, they will read lot of books himself. There is a rubrics under the anxiety hypochondriac uh, reading medical books like rubrics are there hypochondria. They will seek frequently changing doctors. They will have the different type of the doctors at the same time, and they may be thinking about the problem. They will be searching on the Google also to know what is the problem, whether I am having the cancer, whether I am having the diabetes or so on. When to ask about the chief complaints. Now, when we have to ask about the chief complaints, collection of complaints from a person need to be done as soon as the introduction is completed. It has been observed that some patients, as soon as they enter the clinic, start narrating about their problem. They are the nervous patients, and there is such a state of mind that formal introductions seem to be waste of time. They do not want to lose any moment explaining their problem. So immediately when the patient uh, uh, mood is there, you have to see what's the mood of the patient. If the patient is waiting for the introduction, let the introductions get completed. But the patient is very much eager and he is very much in a nervous patient. You first take the chief complaints, then you can take the introductions also. So it is not that you have to follow the steps. Steps can be changed according to the nature and the situations that you can see in the patient. And circumstances that is required for the chief complaints are intensity of the suffering is very high and it is unbearable for the patient. So only because the problem they have the high and unbearable problem. Patient is very restless with the problem, and some patients have impression that doctors do not have enough time to listen their complaints. As such, they should finish telling their problem as soon as possible. This type of the patients are also available coming to your clinic because they had met some doctors who are very busy and they don't give time to the patient and they want that everything should be told to the patient. So immediately they will start talking about the problem so that they can tell as much as possible to the physician. And observing the number of patients also they feel to complete narrating their problem. When in your clinic, if the patients number of patients are too much, so they will also feel that they should tell their problem first and then they should so that they will not wait for the turn because the doctor has to give and more time for the every patient. And then introductions is followed by the chief complaints as I told you. But on certain occasions, chief complaints can be uh, uh, taken first and then the introductions. Introduction. It will be useful to listen the problem first and complete the formality of the introductions later on. This will also help to know the natural nature of problem and extent of intensity in the mind. So overlapping can be done. Introductions or chief complaints or introductions. This is possible. Only you have to leave a space in your the place where you are noting it down to complete the form to make it in a format. Now, you patients usually have to have a list of major symptoms complete that they will wish to be solved for this problem. But first, they will want to disclose the symptoms. Now, patients don't come with one problem; they may have the several problems. They have a list of the problems, and we have to record each one of them to make it complete the record. And this needs to be noted down in the patient's language itself. We have, suppose the patient is talking to you in his mother tongue, you note down the problem in his mother tongue itself so that you can make an interpretation later on also. It will be useful to useful to using the patient's language because information content in them can be retrieved or analyzed for the completion of the information. Usually, patient talking in their own language, they gives you the complete information, but because of your understanding, you may not be able to complete the information. So, you have if you write the things in a or no, make a note of the things in their language, it will be possible for you to complete the information by yourself. And depending on the situations and the provider preference, it may be summarized according to the standard coding systems or written by the whatever system is used, the recorded reason for encounter should accurately represent the patient's explanation for the system. Now, honesty is the best policy. We have to take the information as it is and there should not be changed. In the primary care setting, common IF includes preventive care needed, needing the prescriptions, repeat symptoms related to infections or concern about conditions like diabetes mellitus, high blood pressure, or mental disorders. And RFE code may also be used by electronic medical decision support system to assist the diagnosis. Many times we have to codify it and we can use the codified things for the electronic medical decisions also that we can that is in the advanced stage of the your clinical setup. Now, what are the hidden meaning of the chief complaints? The main concern for the physician is to arrive at those symptoms or group of symptoms which may help constitute the totality perception of them leading to the selection of. For our purpose, the totality of the symptoms is more important. And for this, the chief complaints is the basic area, the primary area where we have. And this great concern and anxiety proves that to result is over excitement and doctor fails to get deviated from the natural circumstances or surroundings of the patient. Now, anxiety is the greatest barrier both for the physicians and both for the physicians and the patient. If the doctor is anxious, he will miss many other things. And if the patient is anxious and doctor is not patient, at that time also there are doctor has to cool every time. He has to have the great patience because only with the patience you can solve the anxiety of the patient. And usually the most useful symptoms may be close to the simple narrations of the patient, but excitement deviates us off and over. Now, many a time when you are patient is telling the symptoms in a very narrations and they will tell you the problem, but if you are so much excited, so you may not be able to listen. Sometimes the symptoms expressed are expressed, but you may not listen. So this is the communication from your anxiety, from your hurried nature, hurried nature or you are overexcited. That's why it is important that you have to be for very much patience but for the thing. Now, what are the how many components of the three complaints are there? Now, the whole session is into the two parts. One is the voluntary narration session, and next is the interrogatory session. Let the patient speak first. That is called the voluntary narration session, and thereafter you have to make your interrogations. That is called the interrogatory session. So these are the two basic components uh, uh, for the chief complaints. Now, first step aspect of prescription for the physician is to listen to the patient. Listening to your patient is the basic thing. If you can learn listening to your patient, it will be most useful things that you can get from that. So listening is greatest art. We'll be talking about the listening later on, the details in the listening later on in another session. But you have to listen. What I used to say that doctor, the God has given you the 2 ears to listen and 2 eyes to observe. This is to be uh, understood properly so that you can get the greater details of the case. Now, principle for the good listening. How we can listen good listen, be a good listener. Listen patiently. You have much patience. Understanding the speaker's feeling. This is important. Restatement and the summary you have to prepare. Avoid expressing. Don't express. I do not allow the myself to express my view, and even I do not allow the attendees to express their view. And let the patient tell themselves because they will be. And so this is the aspect of the good listening, and less explanations. Don't try to get the explanation and have a rapport with the patient. This rapport part is one of the basic things that unite the patient with the physician. Now, voluntary narration session, first aspect of perception for physician is to listen to the patient. Listening is an art and requires great patience. This will include to let the patient speak and make him speaking continuously till he is come out of all the information contained in his memory or memory. Don't break and don't interrupt. Let him keep on speaking, telling you the problem, unless and until he deviates from talking from the main track. Suppose a patient is telling the problem, he will start talking about something else. This will give you the information about the nature, inconsistent nature of the patient. But you have to make interruptions here to put him back on the track. So this interruptions is not allowed, but interruption at some times is allowed when the patient gets distracted or deviated from telling the main problems. Now give a patient's hearing to the patient. You have to listen properly. Encourage him to tell more about the problem. Are you what else? What else? You keep on telling. You keep asking for more. Tell me more. Tell me more. You can tell to the patient, prompting the patient to continue telling his problem. And keep. You have to encourage them to tell the problem. Do not interrupt while he is telling his problem. More sympathetic words may be required on the part of the physician to let the patient. Now, if you are using very sympathetic words, at that time you will find that the patient gets encouraged. Some patients expect that doctor should make an initiation. He should ask. In such cases, it will be useful that after making comfortable and ask him about the problem, what has made him to come to the clinic. Now, some patients there are different types of the patients. Some patients come and they have the expectation that doctor will ask the question. But so what you have to do? You have to see what is the problem. You have to just initiate yourself and assure him to that you will listen the problem. You will try to solve the problem. Then he will become comfortable, and then you can ask him what is the reason that he has come to your clinic. Some patients start with telling about the minor complaint. Now, from where they start, it is not uh, certain. They may start from the minor problem, they may start from the major problem. So, not feeling well since such and such a doctor Saab, I am not feeling well since last 10 years, last 15 years, last 10 days. Now, this is just the problem. This is these are the minor things. Feeling only tired and do not want to work. I don't feel. Now this is he's not telling about the main complaint. He's telling about the minor complaint. So we have to note those things also. The minor problem, how why he don't, and when he tells you the major problem, then you can associate the minor problem that will become the accompanying symptoms for the patient. So this way you will be utilizing both the things. The minor complaints will complement the major complaints. Some patients are confused enough to tell about the problem and expect that doctor will be knowing after his checking up and need not tell them. Some patients are very much confident. Doctors know everything. Now I don't have to tell anything. Doctor knows everything and I don't have to tell anything. This is the mind. So they will not speak. They will wait that doctor make a diagnosis. Doctor will have a physical checkup. He will touch his hand, he will touch his heart, he will put the stethoscope on the body. So he will be expecting like that. Do it. I say you have to do it because it is the confidence that will make him to feel like the solving the problem. Often sleep complaints may not be what the patients really want to talk about. Now, sometimes patients, what he is talking, the concern is something else. Doctors have, my problem is such and such that, like a patient coming from the with the white spots. Now, what he say, doctor, because of this problem, my main concern is that my daughter will there will be problem in my marriage of the problem. Now the chief concern, the main concern for the patient, for that patient is the marriage of his daughter. So this will happen because of this. This will happen because of this. So this is the important. Now that his anxiety, his concern is about the marriage of the daughter. His concern is about the things that will not be done. My family will be ruined with the when I become I will not get well. So these are the things that you have to keep in mind because they are going to tell you very. So physician's part is like a detective work. It is your detective work. You have to find it out how you can find the right thing. Sometimes it doesn't actually reveal itself until the physician has been on the doorknob ready to say goodbye or move on to the next step. Sometimes it happens for the whole session of the case taking. You do not get the information. And at the last, when everything is completed, now the patient is going away. At that moment, you can listen something. You can I have encountered such type of the patients. I have made every analysis. I have done the repertorial process also. And now the patient has to leave my clinic. So now, at that moment, he told something that changed my view and changed the. I just revised my repertorial totality and the medicine system. So chief complaints may happen in the beginning or at the end or any part time or during the case taking process. It may be happen while you are checking the past history or the mental symptoms or the physical symptoms or the family history. Any time it may come, but you have to be careful to note the chief complaint. So we have to handle the situation strategically. What we really want to know from the patient is chief complaint. So simple fatigue, headache, minor problems is not going to help us because they are just the accompanying symptoms. They are just the associated symptoms of the main symptoms. Now comes the next part is interrogative. After you have completed the patient's questions, now it is your turn to ask the problem. Now it is your rights to keep keep on asking about it. After patient finishes telling all his problems, now time has come to complete the symptoms. Complete informations are very important because every symptom has to be completed with a location, sensation, modalities, and concomitant. And patients are not really speaking which sequence. So during the interrogatory sessions, we have to inquire into all those aspects which the patient has not spoken about or which has spoken about. So you have to complete the information coming from the during the voluntary session to complete your requirements. So useful aspects for the chief complaints are location, then quality, character feature like pain, sharp, dull, or aching, severity, mild, moderate, or severe, duration, minutes or hour, timing, onset, actual or gradual, timing, cessation, when it comes and when it goes, and in what context during the full moon, during the new moon, during the summer time, during the winter time. These are the context to contextual. So these aspects will give you the information. So we have to, these are some of the guidelines that I am giving you for the completion of the symptom. Now, there are modifying factors. It gets modalities that is important. Then systemic fever symptoms like fever, malaise, anorexia, weight loss, etc. Then patterns, intermittent or continuous or periodical, frequency, daily, weekly or monthly, progression better or worse than in the past, the disease has increasing or disease in the declining phase, precipitating and relieving factors that any medicine has been used, and associated symptoms like cough, sneeze, hemoptysis, dyspnea, chest pain, orthopnea, like this. These are the useful aspects that will help you in complete the session, complete symptoms. Then you have to make several questions also. So when your problem started first, you have to ask when your problem started first. And this patient will try to recollect his first event. This will provide important clue as and may provide hints for the positive fact. Some guidelines will come from the patient about the positive fact. Some patients often forget when his problem started and they may tell you very vaguely. Some forget at the first encounter and remember only the last time when it began. Where you were perfectly before this problem. Now you have to ask the question. Now the problem is there now, but what were your situations before? Were you very perfect or very healthy or any other problem? The patient will say, yes doctor, from such and such period before marriage I was very healthy and only after getting married I have started this problem. Now this is the turning point. You are getting the turning point, and turning point is important because they will give you the information about the positive factor. And did your problem come suddenly one day or gradually? So onset, um, gradual onset, sudden coming, sudden going, sudden appearing slowly and gradually growing and growing, like this type of information. And then you have to ask about uh, what you have been doing when it comes on. This question will help you to get into the suddenness or onset of the problem. Now, uh, development, sensation, and modeling. How the problems developed after starting, what patient was doing after starting, and coming and going of the problem. This is the developmental. Then sensation, its nature and its severity. Modality, time, physical related, and the mental related. So you have to take them these aspects: development, sensation, and modality. Locations we have already taken of the got with them. Then problems are concerned only with the problem, uh, but finding out the region and fundamental cause are necessary. Now I am giving you some of the examples. Now patient is having the itching. and who report 2 3 months of daily eating, worse at night with no other symptoms and no apparent rash. The treatment for scabies showed no benefit. There has been no significant relief from antihistamine or tropical corticosteroid. Examination is unremarkable with no skin finding other than exfoliation from scratching. Lab work reveals mildly elevated liver function test. Additional lab reveals no acute or chronic infection hepatitis, but further work upon of confirmed primary sclerosis and others. So eating, simple eating, no problem. But with the examination, now laboratory, this is the laboratory investigations that tells you that the leaching is because of the liver function, leaching is because of this chronic hepatitis or because of the sclerosis or paralysis. Now back pain, similarly back pain. Uh, for the 6 months it is there. So intermittent is stiff gait. It may be the MRI. MRI will reveal you something. Then memory lapses. This is also very important that you have to feeling that it was a struggle to remember the something after last 2 weeks or last 15 days or last ever since I fall ill. The problem is continuing and so there may be the elevated calcium, there may be the hypothyroidism, there may be the some underlying factors may be there that may be understood. Then constipation, having constipation bloated in the so for several weeks or several months or several years. Then what happened? He had been taking the medicines for the birth control and has a negative pregnancy test. And after that, the constipation started. And surgical interventions revealed that there was a non-metastasized ovarian malignancy requiring aggressive chemotherapy. So simple constipation is telling you about the bigger problem. Then the fatigue, feeling of the fatigue. And with this also, you can get the major problem. Yeah, my the reason is that the minor problems will tell you about some bigger problem. Minor problems will be bigger problems because the bigger problems are hidden inside your body, inside your life system, and they are revealed only by your laboratory verifications and other things. So unifying or uniting the minor problem with the major problem is important things that is required. Fever is the same type. Blood culture will show the something endocarditis and many other things. Then deep pains. This is also very important that you can find out from the patient. So any of these routine chief complaints would lead us to conclude and even everyday diagnosis forming a treatment plan based on standardized clinical guidelines with predictions of any uncomplicated recovery. But complacency is in a primary care setting could be disastrous. Any complaint, any steps missing. Our job is to drill down through the layers and find out what lies beneath the symptoms that was the patient's reason for seeking the help. Now, what are some of the importance of the chief complaints can be felt as it is opening points for the pursuing the case. One has to be very careful while listening uh, 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 and sense the information narrated by the patient. You may be able to discover causations and get into the entire history of the case. Missing at this juncture of often deviates the physician from getting the most important clue of the case. One should stick to and examine all components thoroughly for location, sensation, modality, and the mild. So these are some useful guidelines. Then another exact locations. Locations also sometimes we miss greatly because for every case exact location provide important guidelines. Patients may tell you that the pain is in the head, but where is the head and which part of the head you have to locate it. Simply listening the word head, you may not understand the exact location, but may find that patient is keeping his hand near the temple region or near on the occipital region or any that part. So his location is something. Then here you may feel that the pain is in that particular area. Then the patient may be telling about it is a boring type of some nail has been here, so that you can get. So location means area, um, length, breadth, and depth. Length, breadth, and depth. That is the locations. The exact locations means length from which place to which place. Then what is the broadness and what is the depth inside. This is the things that exact location is important. Then keeping in mind locations include entire area, length, breadth, and depth. Listening to the entire person of patient and at the same time observing a gestures will help to know the length, breadth, and the location. And during this aspect, when one finds extension of the pain, which also tells you about the nature of the location. Homeopathic mathematica is full of symptoms where exact locations are mentioned. Thus, ignoring this aspect, you may not be able to complete the symptoms totally. And location may be taken as material body where the disease has settled. Now comes the sensation. This complaint is the best place where one can find the exact sensation as, as the patient is narrating with his own care and experience. Now every sensation during your later on investigations you may not be able to find, but during the present complaints session you will get the very important sensation. Life is expressed and experienced through the sensation. Sensation are the feeling experienced by the physician. They may be expressed in words, but at many times patients find it difficult to express his sensation in exact words. He may mean something else, but he may express in other words with him. So he is taking some similarity, comparison. He will be telling you in comparison, or he may be telling you the direct. Like the pain is like it is nail is being put into the. So this is the comparison. It will be useful to listen him properly and observe the way he is expressing and associated body movements like gestures of hand, leg, or other part of the body. Then sensation in a varied way, direct expression through the modality and the effect of the sensation on the life of the patient. So these are the three areas from where you can get the sensation, direct expression. Through the modality also we get the sensation and on the effect of the sensation of the patient's whole of the life. Direct expression is as we begin asking the patient to keep complaint, it is necessary to keep him asking for more. As soon as we have initiated asking for the details, we should keep asking the patient to describe it further and further. Here one comes to the sensation that will find great connection that has that just the printing problems or something that will lead him to the sensation. I usually stick to the very simple question at this stage. Conversation containing like, tell me more about it or describe it further. I don't understand, or what do you mean when you say like this, or what do you feel will lead you to arrive at the exam. So keep on asking, and that will give you the direct expression of the sensation. Then through the modality. Now sometimes the patient will tell you that the sensations are like the waves and liquid state. So with something is flowing. So this is sensation and modality will many a time get expressed simultaneously. And expression of sensation and modality need to be listened carefully, and the physician must stress upon confirming them with or through the associated sensation. Now, effect on the patient's life, present stages. If you, after listening to the whole case history also, you can arrive at the sensation. Because sensation is very acute in the beginning, but with the chronicity, the sensation is diminished. So, this is the real that sometimes expressions you cannot get the direct expressions or the modality. But after listening to the whole or knowing about the whole history of the patient, you can arrive at the conclusion of the patient. So this narrations and everything are very important for the patient. Now, response towards the problem, how he is handling the problem, how he is living with the problem, this is response. Then feeling about the presence of the wife, what are his feelings about the problem, and language of sensation, what sensation language he is using for that. He is using the abusive language, he is using the uh, lamenting language. So what type of the language he is using, that will help you to understand the various aspects about that. Then use of word and sentences. How he is placing the statement in a word, in a long sentence, in a small sentence, and thought about instances. If negative thoughts are there, positive thoughts are there, outcome of the thoughts are there. There are vanishing thoughts also. So many things are there that can help you to know the senses. Which are the effects? Then questioning and interrogation. So repeating the same question again and again will provoke the expectation. Now sometimes you don't get that until you are keep on interrogating, keep on asking questions like so until the patient talks says something. Negative to sensation. Sometimes you can ask a question that is negative with the exact sensation. This will give you whether it is burning pain. No, 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 doctor. This is not burning. It is something like something is pinching it. Now when you have asked a negative sensation, he knows that he can differentiate himself and he will tell you that it is like this. So uh, you have to for observations that you can make for the sensation is gesture, how is telling, his facial expression, his sitting posture, way to talk, response to question, mood variation during the conversation, coping mechanism as expressed about the suffering, and sensation can be observed by minute observation also on various aspects of the patient's life. Now comes the modeling. So, what is the meaning for the modality? Modality means how the patient is adapted to that body. Usually, in a healthy way, we have to adapt. Adaptation is the best way to represent our health. So, life is surrounded by various type of elements which affect in their own way. Internal environment are dependent on the external environment at every aspect of life. As such, of, of one definition of health is the ability to adapt. So health has been defined also as ability to adapt. You are adaptable to the winter season, you are adaptable to the every season. So response to the external stimuli is dependent on the internal nature. And during healthy conditions, there are healthy response, but during the weak conditions, there are the changed response. So these are the aspects that will tell you about the model. Now, modifier or modality means modifier of the sickness or the pain. So modality means modifier of sickness. They will be defined as the modifying and qualifying factors that aggravate or makes a person better, ameliorate, or worse aggravated are essential in the case study. It is closely related to the condition, time, position, sensation, temperature, open air, being alone, motion, sleep, eating, drinking, touch, pressure, discharges, location, etc. In homeopathy, the modality is considered as an important part for the choice of the remedy. And modalities have often the subjective ameliorations or aggravation due to the physical changes in their environment. So, in modalities have the subjective amelioration, subjective which is direct in often see modality are related to the warm, cold, day, night, pressure, affected spot, sound, noise, smell, scent, or aroma. Modality can affect the whole structure or part of it. The essential role of of modality in homeopathic medicine assure the patient's individual needs will, will be added. A patient is encouraged to describe peculiar, even bizarre symptoms and with their patterns. So, different type of the modality, physical modality, altitude modality, time modality, temperature modality, diet modality, localization modality, and mental state, that is the attitude modality. So these are area you have to touch, you have to keep in mind when you are talking about the modality. So prominent persons in homeopathy has given great attention to the model. In Boger concept, totality concept, first importance to the model. The Boger says in Divisia, all experience totality pay attention, great attention to the modality. According to him, modality are cognitive modifiers of the characteristics so much so that the remedy is indicated by all other which does not agree with the modality should be discarded. He also says that the general or special modalities are that to the time of day are much greater importance. Dr. Howley, among the positive factors, predisposing as well as predicting rank cost. So, modality is above than the positive factor and the predicting factor. Modality, all kinds of aggravations and aberrations apply to the case as a whole in the patient are general of the high rank. But it is lining of the author to convince us about the importance of the modality. The modality applied to the patient as a whole and as such play a very important role in the choice of a remedy. Modality helps us in case taking and consequently in repertorization and selection of the correct remedy. Friends, uh, we should keep in mind the beneficial stable characteristics value of symptoms. Who is the patient? What is the problem? Where is the problem? And what are the associated problems? And what are the causes for the patient problems? Then what is the modality and what are the time modality? These seven hexameter of Dr. Bonnigan, you have to keep in mind to measure other things. Fish, speed, UV, viewers of pure, tomato, and unano. So, friends, this aspect you can complete the current symptoms, your current, or you say the chief complaints of the patient to proceed further. But once you have completed the case, uh, the present complaint, with half of the case is done. So this is very important area that chief complaints. So chief complaints, formerly known as chief CC in the medical field or term presenting complaints in Europe and Canada, form the second step of medical history taking. It is sometimes also referred as the region for encounter (RFE), presenting complaints about problems or on admission or region for presenting the chief complaint is a concise statement describing the symptoms, problem, condition, diagnosis, treatment recommendations, return, or other reason for the medical problem. So this is the big concept for our medical understanding. So thank you with these things. And if you find any questions, have any questions in your mind, you can ask me. You can write me at my email ID, riprich@gmail.com, or you can make a phone call or WhatsApp message on my 94310. So thank you, and I stop sharing this. Thank you. So friends, I see some of the questions here. May you you want to have the live case taking. Okay, I will definitely, I think Rahul Pawar, you want to know the live case taking. Definitely Rahul, I will try to have a live session sometimes. I'll make a video recording and place it on this video so that you can see how I am doing myself. Actually, in outside there are it can't be attended. You are this is your personal question. So please, I'll give you the. Definitely, I'm going to reply to your requirements of having the live session. Live session I will arrange and I'll put you the message in advance so that you can see how I am taking the case. So thank you. And now we have come to the end of the session. In the next session, we will try to know about more about the case taking, and that will be the record keeping. I'm going to record keeping because this is an important aspect because everything has to be recorded in the medical history. So record keeping topic will be taken next week on Thursday. So with this, I complete my session. And I say thank you to you all for having a patiently listening, and I hope we will be meeting again and again. Thank you very much.